Hello, 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 Gabs.
George.
That is my name. Welcome back to Mind the Back Chat, and today we're just starting a new little series called
Keep it simple.
Yeah, exactly, because too often I think people overcomplicate things or over worry about certain issues, and we're here just to list some of the most simple things about parts of the body, like what are your most simple conditions or what we most commonly see in clinic and what to do when they happen. And today we're starting with
The lower back.
yes.
So all we're simply going to do is just pretty much keep it simple. So what are the things that we're looking at when it comes to lower back pain? What are the specific kind of tissues that would be involved? What are the processes that they're going through? How could we just sort of try and help with that process, and just to make sure that recovery is
Suited to the patient and as easy as possible.
simple.
Simple. Ah, wow. Okay. No. So brain switching on. So let's start. So in the back, I think there's three main things we need to look at. Really, there's obviously other important things, but I think the three main things that we see present in clinic are probably muscular related issues, discs in the low back, and also the facet joint, also known as a
Zygopophyseal.
that is the photosynthesis
Of our episode today.
Oh,
I use loud words to make myself sound more photosynthesis.
exactly. We're smarter for using it. Okay, so let's start with muscles, because it's something I've been seeing a lot in clinic recently, and I think I put it a lot down to Christmas, a lot down to it being the new year. Everyone's starting to try and be a little bit more active, or if they've got a desk-based job, they've been working at a desk all the time, and now it's January, it's like, oh, I've got to get myself fit, I've got to go to the gym, those muscles are deconditioned and they're being strained at the gym. Now, I don't know about you guys, but is that something you're seeing quite a bit of?
Yeah, I'm seeing quite often, and mainly because we're kind of going off the back of 2 years of COVID.
Yes.
And I think that's a huge thing, because people were taken off of their routine, their stride. So a lot of people that used to go to the gym pre-COVID were unable to do so because COVID stopped us, and a lot of people live in one-bedroom houses or even a room, aren't able to do those kind of routines going back to their training. And then they try and go back to the training post-COVID thinking, I can lift 180 again, and boom.
Pain hits, muscle spasms, tightness, strains.
Lots of
Yeah, lots of painful movements start to kick in. And of course, that's going to start to worry the person, because a lot of times when these strains, aches or pains come in very fresh and very new, they're very acute, so very painful, very limiting, difficult to find something comfortable. And we all start to panic and start to think, oh my gosh, I've done my disc, oh my gosh, I've broken my back, something drastic has happened, whereas just a little muscle acute strain can hide those other symptoms or fool itself as maybe a disc or something, when actually it could be so much simpler.
Yeah, and I think in the attempt of keeping it simple is simply that, well, actually, what we're going to find is stress occurs. That could be in the form of lifting, running, or whatever kind of exercise, or even just immobility, followed by an acute movement that then causes tissue around the joint that is specific to the area you're feeling that pain to then gain pain. Now,
Gain pain.
The way the brain kind of sees these stimuli, let's say, it then transfers it into pain, because pain is an output, it's not an input. So today we will be speaking a little bit about pain science. So we'll be understanding a bit more things like hyperalgesia, allodynia,
Photosynthesis.
exactly. And these are just concepts to do with pain that are simply going to be very beneficial for people to understand. Okay, you know what? It's been 6 months since I've had this pain. Doctors say there's absolutely no problem. Why is the pain still there? So we want to try and keep that as simple as possible.
Yeah, one of my favourite things when it comes to more pain science aspect things is central sensitization.
Oh.
So when you've had a pain for a long period of time, and let's say you don't do anything to get rid of it, it just sits there, becomes chronic, your body, your brain is going to get tired of constantly sending those neural pathways, like that message up and down, like a London tube train, basically, constantly saying, this is pain, this is pain, this is pain. It gets bored. So what it does is it creates a localized response. So it goes into the spinal canal, to the spinal cord, but doesn't go any higher, just goes straight back to, it's like the body's set up, this is pain. So even though it might get better, because you've allowed it to sit there for so long, the body just goes, no, this is going to stay tight, this is pain, because this is what we now know is what's going on in this area, because you've almost allowed it, thought it to become that. And you see that quite a lot.
Yeah, and that's a huge contributing factor to the way the brain maps the human body. Because the way the human body is mapped within the brain, there are specific areas that will cover a little bit more of the brain. So the way the sensitivity occurs in the brain and how it outputs pain is going to be a lot more heightened in these specific areas. So let's say the lower back pain occurs. So breaking it down, you've gone on for a run, you get a bit of localized damage to a facet, it's now irritated, you've had that for 6 months, that pain has been constantly there. What's going to happen is that the brain's mapping of how big that facet is going to multiply. What that means, any sort of stimulus into the brain, because pain is an output, it becomes an output of pain rather than a specific stretch, movement, proprioception, or whatever it is, pain, cold, heat. It just becomes pain because that's the way it's been conditioned to bring as an output.
So a lot of other people will ask questions to me and say, well, how do you know it's not a joint? How do you know it's muscular? Or how do you know it's disc related?
History?
But this is what I mean. So for somebody who presented with a muscular issue, what would you expect their symptoms to be?
I would expect their symptoms to be that if they were to stretch or have specific movements,
engagement of the muscle,
it lessens off, or they've done a bit of walking and it lessens off, or they've done a bit of walking, it lessens off, but then if they do too much, it tightens back up. So that's the kind of pattern that we will tend to find. Whereas inflammatory, which kind of comes from specific tissue damage, which is more commonly within the joint, they will wake up with pain.
Yeah, because what happens is as you lie static at night, you're obviously not moving the joints around, and you allow inflammation to occur. Now, everyone puts inflammation down as a bad thing, when actually inflammation is a good thing because it's bringing healing nutrients to the area, which is obviously going to speed up recovery of a damaged tissue or a strained muscle or whatever. However, in a joint you have minimal space to move, and if you pack that full of inflammation, which is going to happen when you're not moving it, when you finally get up and try and move it, maybe close the joint, it isn't going to be able to close comfortably because it's compressed and compact. So the key is to keep yourself moving, try and keep those joints as least compressed during the night as possible.
So could you give us maybe a little bit of advice to the general public as to what you would kind of want to do? Okay, I'm in a lot of back pain, what is it, that little bit of thing that I can do to give myself relief aside from walking for 30 minutes?
So if we're talking, well, with any kind of joint or muscular pain or even disc, I'd suggest trying to keep yourself active. Yes, saying walk a little bit, but even if you're sat down, try to avoid being seated for anything longer than 20 to 30 minutes at a time, because then you're preventing that chance for all the inflammation to build up. And also when you're sitting, you're just load bearing through your low back anyway, which is again going to cause increased pressure and postural muscle usage. I'd also suggest maybe a mixture of hot and cold, because again, heat is very good at helping muscles to relax. It also helps cause artery dilation, so it actually allows increased blood circulation and inflammation of all those healing nutrients that we like. But then finishing with cold is good as well, because it's just a natural painkiller and can sometimes help with reducing some inflammation in the area as well, freeing up a little bit of movement. Hence why, a lot of times it's quite muscular when people get up in the morning, go have a shower, nice warm shower, they feel better, feel more mobile. That's quite a good common sign of muscular pain. One last tip I give out a lot of times for low back pain is if you're sleeping in bed, Do not lay on your front because you're causing joint compression in the back. Try to avoid lying on your back, flat with your legs straight. Maybe put a pillow underneath your knees if you can't lay in any other position. But probably the best position to be in is on your side with a pillow between your knees, because it keeps your back nice and straight. And with having the pillow between your knees, it prevents your above knee to come across your other knee, putting a rotation through the back again, compressing those joints in the low back.
So these kind of things will only make sense if you look at it from an anatomical level, because when we kind of say compression, that's because the natural curvatures of the lower back are going to be present if you are lying onto your back completely flat. That's just the way it is, and it's going to happen because of the way your pelvis turns and tilts, which then causes that curvature to occur. With that, you're then going to get extension in the lower back, and that extension is what causes the compression. Extension. It's my favorite word. So we've spoken about facets, we've spoken about muscles, and how potentially even the hamstrings.
Well, that's it. What are the muscles? So when we talk muscles, are we just talking about local muscles to the back, or what other muscles can have an impact on the low back? Because of course everything is connected.
As just mentioned, so hamstring is a very big one, simply because of its attachment to the sitting bone or the ischial tuberosity. The way it tightens up, it pulls the pelvis into a posterior tilt,
Leaning it backwards.
Exactly.
Yeah.
And by doing so, it then puts a little bit more pressure into the lower back to try and compensate for what is going on, and that gets it to tighten.
Yes.
Which then also brings on glute pain and
quadratus lumborum pain,
erector spinae.
Yeah, so these are all of these muscles are very much postural muscles. So if you put them in a compromised position, they're all going to start to play up, because the key word that me and Gabs mentioned was compensation. Your body is fantastic at compensating for restricted movements or tight movements. That's why sometimes you may get a slight twinge in your back and go, it'll be gone in 2 days, and it pretty much heals up quite quickly. Then you'll go months or even a year without any problems. Then again, all of a sudden you get a twinge in your back, it hurts a little bit, goes in a couple of days, but then you go a few more months down the line, it comes back again. Maybe then less time, it comes back again. And then you're bending down to put on your shoes and bang, that's when your body goes, I can't compensate anymore. I can't help you here. Here's the payload. Yeah, exactly. And I see that every day. And
the thing is, patients will sort of ask me, how often do you see this? And I'm like, every day.
Every day.
But
it's not their fault.
No.
Because at the same time,
we develop and adapt and get into these kind of habits, and it's going to happen.
But we're not taught that either. We're not taught what to do if you get a slight twinge in your back. We kind of go, oh, it's gone, it's absolutely fine.
Yeah.
Not the case.
We were never taught how to pay our taxes and to be self-employed.
Yeah. Well, yeah. Hey, my taxes are fine. But what the other thing is as well is that this is never covered in school. We've never known what to do if you do get any pains in your body. Most of us just chuck ourselves down A&E, and if you have an acute episode of low back pain, unless you're getting numbness, pins and needles, shooting pains down both legs, you can't control your bowel or bladder, and you can't feel when you wipe on the toilet, chances are, or you're having bowel incontinence, you're not getting anywhere at A&E, because the things I just listed were red flags. Those need to be seen to sooner. But if you go in with just an acute low back pain and that's all you've got, chances are you ain't getting anything.
Most likely just a little bit of Nurofen, Cocodamol, Naproxen. They don't really do diclofenac anymore, just simply
depending on what medications you're already on. If you're
exactly.
On. But that's also because how simple it sometimes can be that's causing the problem. Because as I said, if you have an acute muscle strain, acute facet, it can look like an acute disc bulge as well.
So speak to me about a disc bulge, because you've mentioned before sort of the donut.
So I like to think of discs as a jam donut, as do I know a lot of other osteopaths, because it's a very simple way of thinking about our human body anatomy.
And in our attempt to keep it
simple. Got it that time. Got it that time. So the reason why I describe it as a jam donut is because your disc is basically made up of two major components. You've got the annulus fibrosus, which is a very strong outer shell with very mesh layers to help you deal with rotation, bending, all that kind of stuff, all to keep this nice jelly center in the middle called
The nucleolus pulposus.
yeah, exactly. Nucleus pulposus, love it. It's just so gooey. And so this is literally a spring or a sponge in the middle, taking all the compressive weight from every level of your spine above and helping to transition it into your lower extremity. So you've got that jam spring in the middle with a very strong protective outer shell to keep it all in there. The jam in the middle is basically made up of water. Large solid
Pretty much,
fluid.
pretty
Exactly.
much. But I think the way we have to try and break it down a little bit is that the outer layer of a disc, it's set in specific patterns. However, if you were to do specific movements, which we tend to find is relative rotation and side bending, that puts it in a very compromised position to allow that jam to kind of seep out.
Well, even then, sometimes the jam doesn't move, but an outer layer of the disc may become strained or damaged, which causes local inflammation. So when it comes to discs, everyone just thinks they bulge or herniate, like part of it's come out.
Yeah.
Not always the case. There are so many different kind of levels at which a disc can become damaged.
And I mean, throwing a little bit of a number out there, we find within research that you will find some sort of degeneration or bulging / herniating from the age of 25 onwards. This can be even younger as 18.
Depends what kind of
Lifestyle you have.
Exactly. I've seen rugby players, sadly, who are in their teens, who've been in a challenge where they've gone up to catch a ball, and as they've gone up to catch the ball, somebody's tackled them from behind, causing increased extension, so causing them to lean back in the air. And what that's resulted in is a slipped disc. So the other thing as well is a slipped disc is different to a bulging or herniated disc. A slipped disc is basically when the vertebra above the lower vertebra has shifted forward.
This is called a spondylolisthesis.
Yes, and it can cause spondyloptosis, which is pars fractures of the vertebrae.
Fractures, bone fractures,
Yeah.
just normally.
Just
And-
throwing a little bit of knowledge out there for you. Gabs isn't the only one that does it.
And the only way for us to really find out about these things is through imaging, so X-rays.
Imaging, yeah, exactly. But again, they're very much, and you may go off of that then, so how can you treat or how can you tell if somebody's got a disc, or how do you approach somebody if you haven't had an image done?
Case history.
And that's it, exactly.
Yeah, that's all
what
you
are the
can do.
symptoms? How did it come on? What was the trauma? How old are you? Are you on any certain medications? Was there previous injury? And all these kind of things. And
Yeah.
examination, obviously, following that, if deemed necessary.
Yeah, and I think that's all pretty much well and good. Now, I think the best advice, so to kind of top everything off with that, is in order for things to be kept simple, is if you do have back pain, number one, you've got 3 options. You can either go to A&E, get it checked, because essentially those are the kind of circumstances where you simply cannot walk, you can't breathe, you can't move. Now that's worthy of A&E.
Because they may not. So when I said earlier, when you go in to A&E and they're not going to do anything about it, a lot of people go in there expecting a scan. You're not going to get a scan a lot of the times.
Yeah.
And so you're going to get given, go home, rest it, keep yourself active, here's some medication.
Unless you are one of those specific
Exactly.
Ones where you've got bowel incontinence, urinary incontinence, you've got drop foot, and all of these different bits and pieces. That's when you really need to get it checked. So
Yeah.
that's option number 1.
Yeah.
Option number 2, you can go and speak to your osteopath.
Or
If
even
you've
call
got-
them.
Yeah, exactly. Give your osteopath a call, because 9 times out of 10, if you've had a good relationship with them, and I've done this plenty of times, I've got people who have called me, while I'm in the gym, and true story, they've called me in the gym and they've said, I've done this and this, and I go, okay, let me just give them a call. Now I call them and I went,
Yeah.
oh look mate, I've just woken up 5 minutes ago, I collapsed to the floor from a deadlift.
Yeah.
So
Ooh.
I gave them advice there and then.
Yeah.
I said, okay, let's look for some red flags. Let's make sure that this is safe.
Yeah.
And once I deemed that everything seemed pretty safe, I said, you know what? Come and see me tomorrow. Not today. We need inflammation to try and reduce because it needs to calm down a little bit. Gave him all the advice. Came in the next day and he was like, it was perfect because
Perfect. Help people manage it. So again, if you're experiencing really acute low back pain, ask yourself just a couple questions. And those questions should be, am I getting shooting pain, numbness, pins and needles down both of my legs, or muscle weakness as well?
Mhm.
Am I suffering with bowel and bladder incontinence?
Yeah.
And can I feel myself wipe when I go to the toilet?
So that's called saddle anesthesia. It's
Yeah.
one of the most common things that osteopaths ask, just simply because I know from our case histories, I don't know what physio's case histories are, I just base it on us. We ask that every single time.
I think
anyone says,
I think a lot of physios and chiropractors again ask that just because it's just the bread and butter.
Yeah.
I've had patients where I've gone, this is sounding so muscular, but I'm still going to ask these questions anyway because you just want to make sure. You go to A&E, you go to your GP, they'll ask exactly those same questions as well. It's the first thing on the list to do with low back pain. So ask yourself those questions, and straight away that should help put yourself at ease a little bit.
Yeah, and then so that's option number 2, speak to your osteopath. Option number 3, you can actually call 111. It's
111.
a very good tool.
I love it.
And we've said that before. And 111, believe it or not, when there was COVID and they needed more help, 111 sometimes would actually lead you to an osteopath because we are primary healthcare practitioners. We can give referrals, we can triage. So a lot of people that answered 111 calls were osteopaths.
I mean, just Tuesday this week, I was working in the clinic I work over in Hitchin, and we had somebody call up in really acute low back pain, and they were just like, listen, I'm stuck at home, there's no way I'm going to be able to come to the clinic, can you just give me some advice on what to do? And I just said, right, first of all, what's going on? Tell me how it's come on, tell me again what kind of symptoms you're getting. And at no way at any point am I trying to assess and say like, oh, do these stretches, do this. I just went, right, what you're going to do is you're going to go get yourself an ice pack. You're going to apply that on there for 10 minutes. Just try and repeat that every 2 to 3 hours, to help settle it down. Try and keep yourself moving around gently. Try to not stay seated for anything longer than 20, 30 minutes, but maybe apply a cushion behind your back if you are doing that to give more support. And don't sleep on your low back. And it kind of went, the person on the phone went, that's what happened this morning. I slept on my back and I got stuck, and I was like, difficult to get up, right? It's like, yeah. And again, if I have a patient come to clinic, I will spend time with them showing them a good way to get out of bed if they're on their side, and how to do it keeping their back in a relatively neutral position.
Yeah. It's a little tool that I sort of give to a lot of people as well. Even if they're not in low back pain, I think a lot of people who are a little bit more elderly, lacking range of motion and strength, I give that bit of a tool, because for them, they do find it stiff in the morning to get up. I just say, okay, you know what? You lie onto your side and then you push using both of your arms whilst keeping your back straight upwards, so you're in a seated position, and then from there you can just get up nice and easy.
Yeah.
So those are the 3 options from the get-go as to what you should do from the beginning.
Yeah.
Next step. So you're going to be looking at things such as rest, ice, walking, movement, stretch, just to kind of get a bit of stuff going through once we have established that this is not a red flag.
So here's a question for you, Gabs.
Hit me.
If you just said rest and then you said movement, what is rest to you?
Rest to me is anything that you believe or deem that you're comfortable within that position.
Okay.
So making sure that you have some sort of comfort.
Yes.
Either it be your favorite chair that just happens to hit the spot that you can get out of quite safely,
Hit the spot.
or some sort of couch that then works for you. We've given a bit of advice, lying on a bed onto your side with a pillow between your legs. That's an option if you don't have a sofa that hits the spot, and that's a good option for you.
Yeah, I agree.
But making sure that you move every 20 to 30 minutes.
prevent that inflammation as much as you can. Okay, so that's step 2.
That's step 2. Step 3, once it's not completely calmed down, but it's calmed down to a point where you can get it seen. Get it seen. Go to an osteopath, go to a physiotherapist, go to a physical therapist, go to a chiropractor, whoever it is that you trust, go to them.
Go to your GP if you want.
Yeah. Now, that's completely up to you.
Yeah.
So that's step number 3. Then they will create a management plan and treatment plan and everything else
And
once they've
rehab.
assessed and given a case history.
And also, if you're sat there thinking, I've asked myself these 3 questions and I know it's not a red flag, but I'm getting other symptoms or I don't know what's going on, same thing. Just give us a call, give 111 a call, give the GP a call, give any manual therapist a call. We're all there just to literally help. That's what our goal as practitioners is. It doesn't matter who you are, it doesn't matter what you got. I don't mind if you're not even an existing patient of mine. If this is your first time calling me, I'm still going to pick up the phone and go,
Let me help out.
yeah.
So, in the attempt of keeping it simple,
Yeah.
you're always going to go through these same processes. Number 1, get advice. Number 2, make sure it's not a red flag. Number 3, make yourself comfortable, try and get a bit of relief. Number 4, go and get it checked. Number 5, do your rehab.
Okay, and just to go on from that a little bit, because those are Gabs has said it perfectly there. But with regards to the 3 common things that we talked about, from muscles to facets, which are joints in your low back, and discs, for each 3 of those, what would you say are the common professions or potential predisposing factors, so causation to those coming on in the first place? So let's say muscle. Who would you say is a bit of a stereotypical?
So I'd say for muscles, the most common stereotypical one is someone who is an office worker. Just simply because of the seated position is perfect for hamstrings to get tight, for glutes to get inactivated, for you to have a reduced amount of activity, workload throughout the day, lowering the movement, getting compensation, not having ergonomic setups, things like that. It's the perfect kind of concoction towards you then going to the gym or going for your spin session and your body just saying, nah bro, you're done.
Woo-wee. That was good. Nice. I'd also say at the moment as well, if you've just had a baby and you're a new parent, I'm seeing it a lot. You're starting to carry them on one side. You have to do a lot of stuff with the other hand as well. If you're carrying the baby and they're slowly getting bigger, because that's what babies do and they do it very quickly, all that weight starts to build up on one side. Again, muscle compensations kick in. And I'm just seeing a lot of mums and dads come in with low back pains. And when we ask the questions, they will go, yeah, actually didn't start until about a month after I had my little devil.
Whereas for me, I just fill up a little rugby ball full of sand just to get myself conditioned towards it. I'm joking.
You're
No,
not joking,
no.
though.
No,
I've
no,
seen it.
no.
I've seen it a couple of times actually. You know, I've been over to yours. I see you walking around the street sometimes with a little rugby ball tucked under your arm, and so it's all making sense now, Gabs.
Like, whoa.
Whoa. Okay, so that's muscle. Now let's go on to more the joints. Who would you likely to see?
I'd say I'd be more likely to see someone who does a lot of jumping. So that's a predisposing factor to joints just because of the constant pressure. So people who skip, people who have a lot of rotational movements in their work. So carpenters,
Plumbers.
mechanics, plumbers, engineers, those kind of things is where you'll tend to find, well, actually, they're moving a lot, so the muscles are nice and nimble and they tend to be pretty strong, but there's a lot of wear and tear, degeneration, inflammation that occurs because of
Mechanics.
the way they're kind of doing their work.
Yeah, exactly. And because a lot of these can fall into a lot of them as well. Like if you're working at a desk all day, you're going to put pressure on the joint as well, which is going to cause it. So there are some crossovers as well. But then if we go into the more disky related issues, I'd say I'd see it a lot in more manual workers. You know, your bricklayers, your plumbers again.
Yeah.
The gas man.
Yeah.
All this kind of stuff because they're in those compromised positions for so long. Gardening.
Oh yeah, yeah. But you know what? I'm gonna throw a very common one out there,
Yeah, well, I'm glad because we're keeping it simple.
keeping it simple. Gymnasts.
That is it's a very common, it's a very, very common one because they're throwing themselves in all different angles and all putting that disc under so much pressure. But is it that common? Because are you seeing that many gymnasts?
Yeah. So in regards to look, it is a
What
predisposing
do we
factor.
see? I guess is
What we
that's the
see
sort of-
is what George kind of said. But if you are a gymnast and you do it quite heavily, it is a predisposing factor.
And one person I see with all three of these, farmers.
Yeah,
Because it's lifting, it's carrying, it's the same position.
Yeah.
There's a lot of admin in farming now as
Yeah.
well. So
So
you might be
makes
saying,
sense.
gosh, if all these things cause it, what can I do to help it?
Just try and live a normal life in a sense. Do what your body tells you to do. Because if you are someone who's at a desk all day, do your little walk every 30 minutes. If you are a farmer, maybe try and keep yourself a bit more nimble doing a bit of stretching because that's something that they will not commonly do.
Yeah.
If you are someone who is in construction, then maybe look at some sort of yoga or Pilates where you can get your core so that when you are doing any sort of lifting or manual work, you're doing it correctly using your core instead of your lower back in a sense. Let's not go into that because I know a lot of people hate that.
And people, if you are listening, don't pick things up by bending at the hips. Bend at your knees and keep your back straight. All the time people tell me, when I bent over to pick up my shoe, get something out of the boot, go this, and it's like, what position are you in? And it's always the same. And I know we all know the right way of doing it, so why don't we do it? Why do we go into our head afterwards like, I should have bent at the knees, or people come in and tell me like, I know I should have bent at the knees, and it's like, well, we've got to start doing it because it is so easy to cause a strain that way, and it's so easily preventable.
Yeah.
And the other key as well is the truth is, and I will say this every podcast if I have to, movement is medicine. You have joints and you have muscles to move those joints. Not a single part of our body is created to be stable. There is even a 1 in 100 millimeter of movement in your cranial bones as well. Everything is made to move. Why are we now living in a world where we've got to be so static, decondition our muscles so that when we are active, we actually end up getting injured? How crazy is that? And that is another reason I became an osteopath, because when you experience loss of movement and intense pain, and you cannot move and do the things you want to, it is terrifying, and you do not want that. So please, 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 find a hobby, find something that just gets you out daily or at least 5 times a week, that keeps you active, keeps you strong, and improves your cardio, because we need it.
Yeah. And you know what? Let's end it there. Ladies and gentlemen, this is Mind the Back Chat. This is the tin of Mind the Back Chat.
10th episode.
10th episode.
What did you say, tin?
Tin. So a 10-year anniversary in a wedding is called a tin.
Ah, okay. So, okay, we're a tin.
Yeah, we're
Tin
a
baked
tin.
beans.
And we are the casually professional osteopaths.
Or professionally casual. Anyway, ciao for now.